Hi, I'm Michelle Laws, Chief Experience Officer for the North Carolina Medical Society. Thank you for tuning in to the Medical Society's podcast, Public Rounds. This podcast is designed to inform the public about important healthcare-related issues. We are so honored to have as our guest today Dr. Osi Udekwu. Dr. Udekwu is a surgeon at Wake Med and a board of trustee member for the North Carolina Medical Society. We are excited to have him here to talk about a very important topic, and that is gun violence and the related trauma. Couldn't think of a better guest to have on today's show. So thank you, Dr. Udekwu.
Thank you.
So, Dr. Udekwu, I don't want to get us, saddled down with a lot of statistics and turn off our audience, but I do want to set the context for today's conversation with some really startling, at least startling to me, statistics. According to the Center for Disease Control and Prevention, the number of children and teens killed by gunfire in the United States increased 50%. 50%. Between 2019 and 2021. In 2019 alone, before the COVID pandemic, there were 1,732 gun deaths among U.S. children and teens under the age of 18. By 2021, that figure had increased to 2,590. Another statistic to go along with this is more Americans died of gun-related injuries in 2021 than in any other year on record. And then also, listen to this. In 2022, a study was released comparing the top wealthiest countries. And guess where we ranked? It was found that firearms are now the number one cause of death for children in the United States and ranked number 5 among the 11 large or wealthiest countries. Number 5. So I want to start us out by asking you, what is going on here? What's going on?
Well, I think that the social stress has increased substantially over the last several years. You see it in the context of the response to COVID with the conflict regarding the public health measures that had to be implemented. And then you see the increased alienation between different political groups within the society in the United States. All of this social or toxic stress certainly contributes and is seen in the 24-hour news cycle and the anger and resentment towards rule of law. These are all things that have I think a long-term psychological effect on the populace. We do know that violence itself is expressed in many societies. The consequences of violence are worse if the offenders have access to firearms.
And I do want to make an important distinction so that our audience know that we are talking about, when we talk about the leading cause of death for children, we're talking about firearm death, so not necessarily gun violence, because suicide is also included, right?
That is correct. So we generally divide patients' injuries from firearms into homicidal, suicidal, and accidental injuries. And I think that we advocate as physicians that we use a public health model to try to reduce the consequences of firearm injuries in those subcategories.
So when you say a public health model, unpack that a little bit. What type of interventions are a part of that model that would make a difference?
So I guess the number one thing is that we want to make changes that can have an impact now.
Such as?
The theoretic change of eliminating firearms is not something which is a practical thing right now. So the question is do we stick our heads in the sand and just allow the injuries to continue, or are there measures that we can implement that will be acceptable to the population in general that will result in reduced injuries?
So what, if you had a magic wand, or if you were given access to the state treasury or the federal treasury, and they said you can have all the money you want, what kind of interventions do you think could make a difference?
Well, I can tell you what we're working on in North Carolina.
Okay.
The trauma surgeons meet quarterly in North Carolina, and we've all accepted that firearm injuries with their dramatic rise, especially in young patients, need to be addressed. So one of the initiatives that's taking place is the creation of hospital-based violence prevention programs, where at the time of a firearm injury, the victim can be assessed. And if it is a homicidal injury, then that injured individual can be referred to resources within the community to try to close whatever gaps there were that predisposed the patient to injury and prevent recurrence or retaliation. So if there's, for instance, an individual who is injured and it lives in the context of no housing, lack of mentorship, lack of access to food or shelter, those things can be addressed with programs that are already available in society. So the individual is met and engaged with by a full-time violence interrupter who can tease out in a non-confrontational way what those contributing factors to the patient's injury might be, and then perhaps place them in a situation where, with help, that recurrent injury can be avoided. In addition to that, there's the issue of what in the past may have predisposed the patient to be in a situation where they're injured from firearms, prior traumas, growing up in poverty or with lack of access.
So, Dr. Udekwu, am I understanding this correctly? So with these violence interrupters, they would be in the hospital. So before you guys release the patient, they will be connected with...
We'll have a hospital-based violence intervention program employee whose full-time responsibility is to make contact with and provide the connections in the community for that patient to have better opportunities at avoiding recidivism or future injuries.
Great. And we had talked before, so there's some more to that I think addresses possibly social determinants or social drivers.
So that's in the background, the understanding that we are approaching all of the trauma patients now with what we call trauma-informed care, where we recognize that social determinants of health and prior exposures to violence are big drivers of firearm injuries. So with that recognition, I think collaborating with the resources with other resources in the community, we have an ability to try to intervene and reduce recidivism. These programs have been very successful where they've been implemented, and they're being implemented in a number of locations across North Carolina.
And Wake Med is one of them.
And Wake Med is one of them.
Okay. That's great. Let's get in my Jetson mobile. So back when I was growing up, the Jetsons was a popular television show, and you could get into the family would travel throughout space in their little jet mobile or whatever they called it. I can't remember what they called that time. I'm going to transport us into a classroom or into an auditorium talking to kids who may think Maybe because of the type of video games or, games that they're involved in, that, oh, you shoot somebody, they pop back up. They'll go into the next scene. Describe at that level, like we're talking to kids, what are some of the things you see when someone comes into the emergency room as a gun, especially young person? It's not all glory and you get up to fight another day.
Many patients who are injured from firearm violence have permanent disability. Many of them don't ever come to the emergency room. The picture is usually one of anxiety, stress, and tension. The medical team is trying to assess the severity of injury and intervene to try to save the patient's life or limb. And the family are shocked when they become available, distressed by the sudden change in health in a young patient, especially if it's one of these under 18 people who are injured. The injuries may be in the context of an accidental gunshot wound. For instance, we've had patients who've been injured by their children pulling out a firearm from their parents' purse and accidentally firing at the parent. We've had children accidentally discharging firearms at each other when an unsecured firearm is found at home. So all of us, I think, in either the context of the injury itself, especially with children, replace the faces of those children with ours, and wonder if our children too are vulnerable to those things. The public health model says that if we're going to try to, the access is one of the factors associated with injuries. So if we can even just do something as simple as reduce access by having either voluntary or mandatory safe storage and accountability for firearms,
that could make
a dramatic difference. Many firearms used in illegal activities are secured by theft. One of the common locations for theft is from the glove compartment of a car. So safe storage becomes could be a huge immediate win with an immediate impact on the number of injuries that we're seeing. So again, this is in tune with the public health model.
Right. So this is not a political statement. Just want to make sure everybody understands that what you are saying is what medicine, what public health, what epidemiology, what all the data in those areas lead to that conclusion, that if you say storage is the
so we want to,
it's not a
it's one of the low hanging fruit,
right?
It's not politically controversial,
right?
And it could accomplish a large amount of good. And I think that securing those types of wins, if we can demonstrate a reduction in the number of firearm injuries by encouraging safe storage, then the community sees that impact, and the lowered level of violence and injuries and nonviolent injuries as well, and they can turn around and maybe be more accepting of another or other public health steps towards reducing firearm injuries.
Right. I want to talk to parents now. So kids, we say it's not a pretty sight, and
there's no glory in being shot.
There's no glory in being shot. I think that's the best. That is the best one line. Yeah, there's no glory in being shot.
And you don't, like you said, you don't just pop back up.
Just don't pop up and move into the next scene. That's right. So for the parents and for the community, this is public rounds. So this goes out to the public, not just among our members at the Medical Society. What do you want? What's the message that you would say as a doctor?
Well, there's one message. There's one message that hasn't changed, which is that when you own a firearm, the risk of injury to yourself or your family is significant, and you should take steps to understand what appropriate or safe storage is, and you should go ahead and take those steps today.
Right. So it's not in the closet. It's not in a shoebox under the bed. It's not in a mattress. That's not safe storage.
Safe storage involves there is a broad range of things. There are trigger locks. There are barrel wires. There are gun safes. There are a number of different approaches that you can take.
Right.
Some of those approaches protect your ability to rapidly access that firearm if you are keeping one for safety.
Yeah, right.
So safe storage doesn't preclude legal access.
Right, right. As we're winding up, this goes really quickly. We will have to have you back because this conversation must go on, continue to go on until we see the numbers go down in terms of deaths and injuries and long-term impact on our kids and individuals. I remember back in the 90s, Dr. Deborah Prothostith she was in Chicago, and she at that time she was seeing so many young African-American kids come into the ER that she was treating and they were trying to save. That was back in the 90s. And here we are in 2023 having the same conversation in terms of, gun violence, identifying it as a public health issue and in some instances crisis. What in the world? Why haven't we gotten it yet?
Well, I think that the whole firearm injuries have been clouded by the politics of the right to bear arms, the Second Amendment rights, and it's not been looked at as a public health issue. I think that's the main problem. I think that the dialogue or the discussion has to change, and we have to say to ourselves, how can we reduce the burden that these injuries and deaths cause in society without impacting on Second Amendment rights?
Right.
Because we must do something.
Thank you so much. Thank you so much. This is a sobering conversation to have. And like I said, we definitely need to keep this conversation going until we see a change in the outcomes that we are seeing right now. I never end a public rounds show without asking our guests two things. The first thing is, you see people dying now almost probably every day or near death, and you see some really, difficult cases. What do you do to take care of yourself? Self-care is so important for physicians, and especially those that are in trauma, critical care and the like.
I am an amateur photographer.
Oh, right.
And then I
claim that.
I do a fair amount of travel.
Oh, great.
I used to run, but unfortunately, related to some age-related changes, I'm unable to do half marathons and 10-milers anymore. I think I did my last one was the segmented COVID-19 mile challenge that we all did on our treadmills at the beginning of COVID. And I do miss that. But yeah, I do. I staying active and having extracurricular interests is, I think, very important.
Yeah.
I also, during COVID, honed many of my cooking skills as well.
Great. That is a great hobby to have. And apparently there are a lot of new social media influencers that were discovered or that discovered themselves that they were master chefs during COVID. So,
well, I wouldn't style myself as a master chef, but I think I'm doing quite well.
Oh, that's good.
I did cook dinner Monday, Tuesday, and Wednesday this week. My favorite source, and I'm going to go on record saying this, is the New York Times cooking app.
Oh.
They have some fantastic recipes.
Okay. Well, I am a subscriber, and I do occasionally click on their recipes, but yeah, I look at them. I don't often get to the point of cooking them, but favorite books. If you had to choose 3 or maybe even just one, what book would you recommend that really was impactful to you?
That's a very interesting question. I'm a pretty avid reader, so
yeah. Give us some good ones, 3 good ones that you would recommend.
I think Ender's Game was good.
Ender's Game, okay.
I think that Animal Farm was an influential book for me. And then what other book would I put out there? A long read, The Gulag Archipelago.
Oh, well, we'll probably have to look that up and put that on the screen. Say that one more time.
Gulag Archipelago.
Okay. Is it a fiction or non-fiction?
Alexander Solzhenitsyn.
Okay.
Book.
Not familiar. And I'm an avid reader, so that's why I asked this question, because I too am an avid reader. So I love books. Okay. I'll have to, is it a fiction or nonfiction?
Well, I think it's stylized fiction in the sense that it's based on true circumstances of imprisonment in Soviet Russia.
Wow. Well, I'm getting the time signal. Time flies when you're having fun, they say, and time certainly flies when we are having really good conversation and discussion about important topics and health topics, and that's what I love to do. So thank you so much for being such a gracious and amazing guest who really gave us a lot to think about. And thank you for sharing your knowledge and insight into this important topic.
Thank you for having me.
We will have you back. And thank you for tuning in again to another segment of Public Rounds. Remember, it is important for all of us to be informed and educated about healthcare topics in order for us to create a healthier North Carolina. Until next time, take care of yourself.